Hello everyone. Today we'll discuss another multiple choice question. Let's begin with the question. A 25-year-old man present to his primary care physician, that is clinician, after several episodes of severe crampy abdominal pain. Okay, and this is relieved by the passage of loose stool which is mixed with blood and mucus. Okay, he says he has been feeling fatigued for the past 3 months and he has lost 6.8 kgs. There is a weight loss, and along with that, he has a fever of 37.3 degrees Celsius. Abdominal examination is notable for hypoactive bowel sounds. Okay, and diffuse tenderness with guarding present. And colonoscopy investigation, it reveals diffuse continuous ulceration of the intestinal mucosa extending proximally from the rectum to the splenic flexure. Okay, and diagnosis is made, and the genetic testing, okay, it reveals the patient carries HLA, human leukocyte antigen subtype, which is commonly associated with this disease. So the question is, which other disease is associated with the same human leukocyte antigen subtype? Option number 1, diabetes mellitus type 1, 2, ankylosing spondylitis, 3, Graves disease, fourth one is rheumatoid arthritis, and fifth one multiple sclerosis. So in this scenario they have given 5 options. Okay, based on the case scenario we have to identify the exact proper diagnosis, and this diagnosis carries HLA. So among these 5, which one carries same human leukocyte antigen? So that is here the question. So now here primary care physician, that is 25-year-old man present to this clinician, several episodes of crampy abdominal pain with bloody diarrhea. Okay, and lost 6.8 kgs. Abdominal examination shows diffuse tenderness with muscle guarding. Okay, and colonoscopy reveals diffuse continuous ulceration of the intestinal mucosa from the rectum to the splenic flexure. Okay, and HLA is present. So here this scenario shows one of the inflammatory bowel disease called ulcerative colitis. So it is a chronic inflammation of the intestinal mucosal and submucosa, okay, of unknown etiology. Okay, and crampy abdominal pain which is relieved by passage of stool which is mixed with blood and mucosa, bloody diarrhea, and it mainly affects the rectum, and from rectum it extends proximally up to the colon, here splenic flexure. Okay, and continuous ulceration of the whole part of the large intestine up to the rectum. Okay, and colonoscopy shows friable mucosal pseudopolyps. So all these findings suggestive of ulcerative colitis condition, and this is carries HLA B27. Okay, so among these options which one carries same HLA B27? So here the condition called ankylosing spondylitis, it also carries HLA B27, human leukocyte antigen B27. So the answer is ankylosing spondylitis. So how to remember the condition in which the genetic test shows the person carries HLA B27? Remember, like PAIR pair. P psoriasis, A for ankylosing spondylitis, and I for inflammatory bowel disease called ulcerative colitis, and R for Reiter's syndrome. This is 4 condition associated with human leukocyte antigen B27. Okay, so coming to the diabetes mellitus type 1, it is associated with HLA DR3 and DR4 subtypes. So it is ruled out. Graves' disease and celiac sprue, they are associated with HLA B8 subtype. Then multiple sclerosis, okay, SLE, good pasture syndrome, they are associated with HLA B2 subtype. And rheumatoid arthritis, autoimmune disorder, it is associated with HLA-DR4. So among these 5 options, ankylosing spondylitis, it associated with HLA-B27, same as ulcerative colitis. So here option 2 is the correct answer. Thank you all.